You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme full mouth reconstruction, smile makeovers. With us, we have an expert on this topic, Dr. Roberto Velasco. Dr. Velasco, welcome
Randy,
to the program.
Thank you for having me.
Good. Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible. But for people that don't know your practice, like who's the typical patient and what are the different services you offer?
Oh, God, almost everything. So the practice that I run or that we run is focused on full mouth reconstructions, on rehabilitating people that are broken down. But we see all the ranges of patients. We have.
But by the way, can I interrupt for a second?
Yes.
For a working definition for today's program, what is a full mouth reconstruction? Like in your lingo, in the dental world, what is it?
A full mouth reconstruction is somebody that is broken down either with no teeth or with failing teeth, and we put them back together to work. Their mouth works properly, their mouth looks good, they feel comfortable, they're healthy, super important, and they gain back everything that they've lost because they've lost function, aesthetics, self-esteem, so it's putting back together a human being that is broken down.
Okay, good. I interrupted you. So back to your typical patient.
So the typical patient is, again, many ranges. We have from small to big. We have patients that just want to look better because their teeth are stained or little gaps, or they're mildly broken down over the years. So this is a patient that we make over with veneers. We have a patient that is a heavy grinder. A lot of heavy grinders. In today's day and world, everybody's stressed, everybody's nervous, everybody is, we live in a stressful world.
Yeah.
So these people that are grinding their teeth are wearing their teeth down and they're breaking down, they're losing vertical dimension, they look shrunk and they look older and they smile and all you see is little yellow stubs. Well, this is the patient that we can make over or rebuild with a full mouth of crowns that look beautiful, function beautiful, and give them back what they've lost. The next patient is the patient that started losing teeth a long time ago. Either due to decay and they're breaking down, or due to gum disease. And they started losing teeth, and we find them in the middle of the road.
Okay.
And we decide, okay, what do? We rebuild them as they are, saving some teeth, or we rebuild them, extracting all the teeth. It all depends on how they are, how they present, but we can do either way. We can save some teeth and place some implants and rebuild somebody to full mouth aesthetics, cosmetics, functionality, or we extract what's left behind and give them a full mouth of new beautiful teeth supported by implants that work great, look great, and give them back everything they've lost. So another group of people that we see is the denture wearers. People that have been in dentures for a while, they lost all their teeth and they're in dentures. The funny thing with these people is that they're out of the system. These people decided that they no longer go to the dentist. Dentist in Latin comes from the Latin of tooth. So the dentist sees teeth. These people have no teeth. So why go to the dentist? There's no hygienist for that. There's nothing for, so these people fall out of the system and they gradually lose bone, they lose facial characteristics, they become more and more uncomfortable, they start losing health because they can't nourish themselves well. They start using these horrible things to stick dentures to your gum, which I can't think of anything more absurd than denture adhesive.
You don't like dentures?
Oh God, no, I hate dentures, and that's part of my specialty. But I hate dentures because people do not live happy with dentures. People learn to live with dentures, which is different.
Okay.
But they're not happy. None of them. There's not one patient in dentures that can say I'm a happy guy. No. They learn how to live with them.
They're adapting,
but they're not happy.
They might be happy, but they don't like the way they eat or chew or whatever.
In today's day and age, with dental implants, we can transform these people from wearing a denture that moves, that sleeps in a cup, that no longer gives them what they want and need, to teeth that stay in your mouth, that never move, that look great, that function perfect, that give you back confidence and everything that you've lost.
Full mouth reconstruction. We're talking about rebuilding somebody with really bad teeth to having a great smile. Can you ever be too far gone?
No. That's the cool news. I get a lot of patients that walk into my office and they sit down for a consult and they're really embarrassed. They feel bad. They feel that it's their fault that they're so broken down. They feel that were the ones that neglected themselves and
Do they say this to you?
Oh God, yes. Yes.
Do they say like, Doc, this is the worst you've ever seen?
The thing is, we dentists tend to be very egotistical or egocentrical, if you want to call it, and we can't lose. So whose fault is it if your teeth break down? It's yours, it's not mine.
All right.
It's your fault. And we pound it on the patient. And patients that are breaking down feel the
pressure from the dentist.
The pressure and
or the guilt trip.
Exactly, the guilt trip. That's the word. And they come to us saying, "I'm broken down, and there's nothing you can do." And I guess I'm sure that you've never seen worse. And I promise you, I've always seen worse.
Okay.
I've always seen worse. So can we fix them? Yes, we can. We can fix almost anybody. Almost anybody in today's day and age can be fixed.
Now you say you take somebody with really bad teeth, you give them great teeth again, and their whole life changes in certain cases.
Oh,
really?
I would say in most of the cases. That's the beauty of what I can do. What we do is we see people change not only aesthetically. So that's the main change, and that's the biggest change. Or for us, that's what we embark. But then we see these people become happier, become more self-loving, and they start changing around us. They start dieting. They start wearing more makeup.
Just because of their teeth.
God, yes, and it's incredible how people wear themselves down when they have a bad smile.
What does that mean? What do you mean wear themselves down?
God, they just let go because.
Like they don't take care of themselves?
Why, once they get to a point where they can't show themselves to the world, just, might as well hibernate.
Okay.
So these people are walking around covering their mouths when they smile. They the hair is kind of like covering
You could spot
the
them?
face.
You could spot these people?
Oh, God, yes.
As a dentist,
yes.
you could say, I bet they're hiding their smile.
Yes.
Really?
Yes. And not only females, men too. Men start growing facial hair, covering a little bit. They start not smiling. They become more serious, more apathetic. A lot of things, a lot of changes happen, and it's lack of self-esteem.
Okay.
You start losing that self-love. So the smile gives back a lot.
Now you say it can be done in one day, like in a short period of time.
Some of the procedures that we do can be done in one day. Yes. A lot of them, or most of the procedures need more, like veneers, for example, 2 appointments.
Okay.
2 appointments.
That's not a lot.
Yeah. No, it's nothing. It's 10 days. There's procedures that we do with implants that we can do in one day. So I can restore a person from not having any teeth to having teeth fixed in their mouth, that stay in their mouth, that don't move at all in one day. That's pretty incredible.
That's good. So you brought some photos. What are we looking at?
Yes, we have a little bit of everything.
Okay.
The first person I have here this is a beautiful story. So this is Karina, is a very nice patient. She's a mom. She has three kids, and she started losing teeth when she was very young. She started suffering with dental disease when she was very young. But she was taking care of her kids, raising 3 kids. She put them through college, she put them through life, and she let go of herself. So the first day she came to me for her consult, she was crying, she was in tears. Her teeth were so bad. She was with her daughter, and her daughter had just graduated college. And her daughter wants to see her mom back to where she was. And you can see the picture. Look at her before. The before is
so that's her smiling.
That's her. Here's another one of her before. Her smile is, she's hiding it. She's trying not to show.
You can only see the bottom teeth.
No. And her bottom teeth, she only had the front. And anyways, very broken down, very sad. Her hair covering the face, trying to not show. So we did her full mouth reconstruction 2 months ago. She was at my office. Today's Friday, Wednesday.
Okay.
She was in my office on Wednesday, and she came for her 2-month follow-up. And she sent me that picture that you see there. She gave me that picture. That's a selfie she took in her car while she was driving.
Wow.
And this is her 2 months later. Look at the difference. Look at the difference. This is a totally different woman. She's a new woman.
Yeah, it's
she
true.
smiles. She's happy. She looks 20 years younger. She feels 20 years younger. She's working on her not only her it was not only her smile. It's her.
You say they start working out,
person.
they go to the gym.
God, everything. Start dieting, start
Really?
trying to look better. You know, total. I can see it in the way they dress, they walk, the makeup. It's a new person. It's incredible. Okay, so look at the before and after, and look at her. On her before picture, you can't see any upper teeth. You can't see anything. Basically, she's hiding it all.
Okay.
Look at her after. You know, beautiful teeth that bring her lip out a little bit. Beautiful teeth that follow her lower lip, and a smile that fills not only the mouth but the face.
She looks younger.
Oh gosh, 20 years younger. You know, look at the shine in her face. Her eyes look different. Her eyes look different because of the. It's incredible. She wants to. She feels new. That's a new person. That's the kind of things that we see at the office that make us want to go the next day. So here's another guy. This guy, super nice guy, very successful. When he came to me, he told me, I have not smiled in a picture in the last 30 years. My wife, he's happily married, beautiful woman, nice family. My wife wants me to start smiling now that I'm retiring.
Okay.
I'm getting a new life. I want to feel a little bit more. We went through the different options, which is one of the cool things we have. We have many options. Not every treatment, there's no cookie cutter treatment. You know, some of these places out there, everything is one treatment fits all. So we sat down with Jeremy, and we were looking at his options. He comes to me and he wants a new smile. He does not want braces. He does not want to lose his teeth. He wants to look the best that we can make him look with what he has. So on him, we did basically a full mouth reconstruction. We did veneers in the front. We did some crowns in the back. We changed the way his mouth functions to make it work properly from here on, and to make it be stable. What is it? What is that? This guy, Texan, we live in Texas, loves steak. We love barbecue in Texas. We want to eat steak. We want to feel. So that's what his guy is eating normally, no problem. He has a normal life, but with the caveat or with the add-on that he has a beautiful smile now.
Yeah,
look at that.
looks nice.
Look at the difference. Look how dark his teeth were. Look how dark he had a tooth that it was so turned in that it didn't show in any pictures. There was a shadow always there, and that was his biggest problem. He felt that people thought that he was missing a tooth in the front, and it was not. The tooth was discolored and tilted in. So with veneers, we changed everything. You can see there how the teeth meet now. This is a new guy. Again, it's a long life process of people that were scared and suffered through dentistry and suffered through life, and we can put them back together without that much suffering. You know, chronic dental disease or chronic dental. These people have been chronically mismanaged in dentistry. And if we do things right, if we plan things right, and if we do things right, we can make him happy again. So the day we finished, the day we actually no, a week later, we finished, and I always give my patients a bite guard to protect the dentistry they have and to protect them from grinding and clenching. And you know, it's kind of like the dental insurance for the future. If they're compliant and they're good, it'll last them a very long time. So anyways, long story short, the following week, his wife comes into the office and she gives me a great big hug. And that is pay for me. That's amazing. That makes us happy.
What does she say? Like,
oh, she loved it.
Thanks for helping my husband.
She loved it because she feels that she got him back. This guy's happy now. This guy, look at the smile. Look at the difference in his face.
Yeah.
It's a huge difference. The way he's the shiny new life. So this is another good story. This guy's a cop.
Okay.
He's a cop that, and from his mouth, his story was, I'm sick and tired of being patched. I've been going to this dentist for X amount of years, and before that I was going to another dental whatever chain that was, every time I went, all they did was patch me up.
Okay.
But I was never treated in a complete sense of the word, never. And he was breaking down because he was never looked at from a complete standpoint. His treatment was not extract all the teeth. His treatment was not veneers and just cosmetics. We did an amazing or a beautiful combination of.
So this is like a full mouth reconstruction.
Yeah, it is a full mouth. All of these are full mouth reconstructions.
Okay.
There's many different ways we can reconstruct the mouth. There's not only one, but we did one side traditional dentistry with crowns and the other side with implants. Put them together and it looks amazing. You can see in the afters. So once we finished with him, the biggest thing was getting him to smile again, getting him to learn how to smile again. He's a heavy clencher. Okay. Every time he smiles, he clenches his teeth down and he tries to break everything that is in his mouth. So you can see it in the smile.
So you teach him that'll soften up over time?
Well, I think he'll get there. He's wearing a bite guard a big part of the day, just because his work is more stressful than ours, and he has a complicated working environment. But he'll get there. Once he gets used to being complete again. But he's super happy. Now, I forgot to mention this, and which is a part of the story. His son was getting married, and he wanted to look good for his son's wedding.
Nice.
This guy comes to my office now. Every time he comes, is a big hug. He's like a little teddy bear. He's a cop, and actually, there's a picture, and I'll tell you this story. This is funny in a minute, but he's a big, police officer, but he comes in and he's a teddy bear. Nicest guy. So talking about the police officer and the teddy bear, probably like a month ago, I walk into my office, 7 o'clock in the morning. We start very early at 7. Walk into my office at 7 o'clock in the morning, and I walk into the office and I see several patients and 2 police officers in uniform in my waiting room.
Okay.
So, shh, what did I do
You're
now?
in trouble.
What
Yeah.
did I do now? I know that it's not me. Must be one of my. Anyways, so I have several patients that are police officers, but they're always going their CVs. But now that they're finished, they go for the cleaning or for the follow-up because of their fast appointments. They go in their uniform, stop a minute, go let us see them, and then go. So I happen to have 2 police officers from different precincts. They didn't know each other. And
they showed up at the same time.
Yes, this is a beautiful picture because I feel blessed and I feel honored that these people, my heroes, are in my office. They come to me. That's an honor.
Very nice, very nice. Do you think that people put off taking care of their teeth because of their fear of the dentist, or they're worried about pain? Because you do a lot of sedation, like oral conscious sedation.
Yes.
I mean, is it the fear? What is it?
It's a combination of things. Fear is huge. Like we said before, start losing your self-esteem. You just start letting yourself go. But pain is a big one. Pain is a huge one. And I know where you're going with that. People want to feel comfortable.
All right.
There's people out there now that all the advertises about painless dentistry. Well, yes and no. Dentistry will always be a little bit uncomfortable. We're getting into one of the human being's more sacred space.
Yeah, okay.
It's their mouth. And their mouth is their window to the world. So we're getting in there, we're invading their sacred space. We have to be very gentle and we have to be very good at getting in there.
Okay.
And what we do sometimes is not very gentle, because it's the nature of the beast.
But they're numbed up. I mean, they don't don't feel it during the procedure.
Yeah, it's not that it's painful, but it could be uncomfortable.
It's uncomfortable, yeah.
Yeah. So we want to take away that edge. We want to make them feel more comfortable. So we have different levels of sedation that we can give them.
Do most people take advantage of something?
Depending on the procedure, but yes. If the procedure is a little bit complex, we try to have them take advantage of it because they're going to be more comfortable.
We have time for a few more photos.
Great. So here's another big full mouth reconstruction. Arthur lived his life letting go. Diabetic, suffered from dental disease all his life. Broken down. You can see in his before, broken down teeth. His teeth were very bad shape. He felt embarrassed.
He never smiled?
Never. That before smile is a forced one. We're forcing him. He got to a point in life, he started a new business and things were picking up and things are good. He wants to look good. He wants to feel good. So we had this amazing transformation. Look at that. Look at his smile. Look at this guy. Doesn't it look like a new guy?
Yeah, it doesn't look like the same guy.
It's not the same
Or at least
guy.
a younger, happier version.
It's not the same guy. And I promise you, his business is booming. He is a happier guy. Hopefully his wife is happy, because if not, trouble in paradise, because now he looks super good.
Okay.
It's the change is incredible. The change is incredible. So look at it before, at his before smile, or his before teeth. That's not a smile. People put it off. People take many years to make that decision to get help.
Before they finally go to you.
Before they finally get help. And it's just years down the drain.
Like they missed out on a few good years.
It's years that you lost. Now look at this guy. This guy all around town. He's a smiley one. I'm sure that as happy as he is regretting not doing it 10 years ago.
Time for another one.
Okay, this is another amazing full mouth reconstruction. If you look at this guy, he came to me, very handsome guy. He came to me, and if you see his picture before and if you see his picture after, you don't have to look at the smile to see the transformation. You see the whole face. This is a totally different face. You know, it's a different person. This guy lost some teeth when he was younger, and he never did much to fix him. He let go, and his teeth were, what he had left was very crooked. He definitely did not want braces because of his age and his engagements, and he wanted to look good fast. With the combination of dentistry, we redid this guy's smile. And again, although I love his smile and I love the way he looks, what I like the most is his overall persona. This is a different guy.
Like totally the charisma comes out or something?
Everything. Look at his face. And you're only seeing the picture. I see this guy in my office. I see look at his picture. He feels a gazillion dollars. Look at him projecting. Look at how he projects in that picture. This guy he's a new man. He's a new man. Can I show you a couple more?
Sure. Cool. 2 more.
Okay. Andrea, this is not a full mouth reconstruction. It's a full persona transformation.
Okay.
Andrea is a beautiful woman. Okay. She's a model.
Let's take a look.
This is her before.
All right. She looks pretty good on the before.
Well, it's what she felt and how she felt. So she called us because she was in a photo shoot, and she saw the pictures, and she said, "Oh my God, my smile is not showing. I'm totally dark over here. What's up with this with the shadows in my smile?" She spoke with a photographer. The photographer said, "There's nothing I can do." So she came to us. But literally, she waited. She went from the photo shoot straight to our office.
Okay.
And she gave me a timeline. My next photo shoot is in 2 weeks. Can you get me there?
Very nice.
Look at the after. This is a new person. She's happy. She's radiant. She even sent me some of her video blogs, and it's incredible how she's changed. You know, super outgoing and super happy.
So if you don't like your smile, do something about it. Especially in today's topic, people need to know that if you're just tuning in, we're talking about full mouth makeover, full mouth reconstruction. So people, I guess, come to you. They're losing some teeth. They need extractions. They've got gum problems. They got periodontal disease, and so no matter how far gone they are, there's always something you can do.
We can always fix it.
Is that right? Okay, yes. Time for one more.
Okay, this is a cool one because of his story too. Richard is the party of the office every time he goes. Every time he goes to my office, it's a party. So Richard works like most of the people in Houston, in oil and gas. And you can see his before. He let go to the point that he was completely edentulous on the top, suffering tremendously, unhappy, not smiling. He was feeling pretty bad about himself. So we put Richard back together with some implants and teeth and a combination of treatments. And look at his face. This is a new guy. He quit smoking.
Looks good.
He quit smoking. He went on a diet. He lost weight. He comes in now. The first time I saw him, he was all like, he was dressed like, I don't like myself, like I don't care. He comes all sharp to the office now. Every time he comes, my staff loves him. He's as funny as can be, and everybody loves him in the office. He's a party. There's a party in the office every time he comes in. He's a happy guy. He's an outgoing guy. He tells me his business has improved.
So when you met him on the before, when his teeth were bad, totally different guy. like a little shy, reserved.
Yeah, totally different. He was.
And most people are like that. That means there's
They're
people watching this.
They're holding back. They're holding back, and they're holding back on life, not in the smile, on life. You know, my life. What is my life worth? What can I do to change my life? Start with a smile. Okay, so this is a quick story. This is a beautiful story. You asked me a minute ago or 10 minutes ago if people tell me if I should have told them before. I was working in a place before that employed by a different company. I opened my own practice, and this patient was in the practice that I bought for a very long time, and she was wearing a partial, and she hated it, and she was unhappy. We did this for her. We rebuilt her mouth, and look at her face, look at her smile, look at a new persona. She was into the office a week ago, hygiene, and the same story as the other guys. She comes in with a hug every time she comes in because she's happy. She feels confident. She feels complete. The smile gave her back.
Okay, good. We are out of time. Final message. Somebody's watching this, and their teeth are really bad. Maybe not to the point where all of them have to come out, but they're bad, and they're putting it off. They've heard what you had to say, but they're afraid. What do you say to them?
Well, come in, let us take a look. We have a free consultation, so we can take a look and see what's happening. But most of all, or better, we can help you, and we will do everything and anything on our end to help you. We have financing.
And we should mention, Medicare, Medicaid doesn't cover these type of procedures.
They don't at all.
Even the best insurance doesn't cover the whole thing.
No. So, but we help our patients get there. We have financing.
Okay.
And we will guide them through the whole process.
Are people financing
Oh,
these
yes.
kind of things?
Yes.
Like
Yes.
routinely, every week?
Yes. I don't have, my patients are not the super wealthy. I have cops, I have teachers, I have truck drivers. This is real people with real problems, and they run away or they leave my office with a real smile.
Now, you're a specialist, you're a prosthodontist. Do you have a bias? That means if you have really broken down teeth, do you believe that you should probably see a prosthodontist? And does it cost more to go to a prosthodontist?
It doesn't cost more. It's the same. Probably average with a little less. Because again, we try to help more people. And am I biased? No, I'm not biased, but I think there's a, if my mom has a heart problem, I want her to be seen by a cardiologist.
Okay.
Okay? If you have a broken down mouth, you should be seen by a prosthodontist.
Okay. All right, good. I want to thank you for coming on the show.
Well, thank you
Great
so much,
stuff.
Randy.
And these, I can find these on your website as well. I saw some video testimonials, things like that. So thanks again for coming on the program.
Thank you for having me. That was very nice.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.